physical therapy. Welcome back for some episodes on the thoracic spine matrix. In episodes 1 and 2, we dug into the nomenclature together in terms of how we assess, generally speaking, going through kind of these three-dimensional zones, but then getting nitty-gritty and kind of tunneling things on in a little bit more appropriately. We used the dowel to look at the tripling of type 1 in sync and out of sync and type 2 in sync and out of sync with a variety of different drivers. We also progressed to bilateral upper extremity drivers with basically a sagittal plane lunge stance, an RXX and an LXX stance. You also heard me in those episodes talk about the closed kinetic chain, the chain reaction-like principles that would further drive and provide another way to assess the response we're getting from the tripling in regards to, do we still have a reproduction of our symptoms? Do we have pain? Do we have a great deal of restriction? And if you remember back to the dry erase board, if not, go back to episode 1 on the thoracic spine matrix and take a look at how I had an R and an L and how we had that greater than sign that went to our type 1 in sync, our type 1 out of sync, and then below that our type 2 in sync and our type 2 out of sync. So we would basically circle the one or put an asterisk sign next to the one that was symptomatic for pain or greatly restricted. And so we would use that as basically a screen to figure out our tissue-specific impairments, but then kind of getting to the root of the problem and looking at the contribution of motion throughout the chain. And so when we get to this closed kinetic chain like qualities and principles, I've used trees like this, I've used walls for several years for the throwing athlete and for individuals that are just really gunky and funky in the thoracic spine. And throughout the hips, we can go after a combination of a lot of different things right here. We're going to take a look at kind of an undomesticatedly domesticated way of doing this now, going after it on a wall. I'll show you some positionings that we'd use on a tree in a further episode. But what I really want to do is take advantage of this time to take you through these strategies. So what you'll see is that if you get someone, let's say for instance, a type 1 out of sync, left rotation, great restriction or limitation, or some irritation, and you take them to the wall, or we could, for that matter, take a look at, hey, build on success. Where were they the most successful? Take the positions that you just assess them with the dowel and bilateral upper extremity drivers, put them on the wall and see what kind of response you get. And I guarantee you're going to have more contribution, more motion that's going to be allotted to and afforded to that individual because of these chain reaction-like principles. You're like, okay, remind me, what are the chain reaction-like principles? What does that mean? Okay, we have multiple synergies or co-contractions going on throughout the system, meaning we don't move in isolation. We move with these diagonal, horizontal-like patterns from our toes to our fingers. We've talked a lot about these anatomy-like trains, these meridians. We have multi-joint compression and congruency, which means, and multi-joint approximation, which means, again, to an episode when we had the screwdriver out, it's a good fit with a Phillips or a flathead screwdriver that allows us to get a good solid anchor into what we're drilling into. The same thing with our joints. We need that good mushing and compression, taking advantage of gravity, momentum, inertia, and ground reaction force to give us a variety of all these rotations and translations throughout the system to get all those physiological like principles of the synovial joint fluid moving, to get those protoglycans within the interarticular surfaces mushed to push out the waste, and to get that ground substance, those glycoaminoglycans, that hydration going throughout the system, to really reinforce a good, healthy, homeostatic-like environment for the joint and for the tissue. So let's go after, and I believe that you guys can see me in this position right here. A little bit of an odd angle, but anyways, we're gonna go after some type 1 out of sync first. So I'll most typically, the higher I get my hand, the less of an effect that I have in terms of joint mobilization, if that makes sense. So there's a happy medium here. I don't want too low, but I also don't want too high to where I'm really able to mush in right here and anchor. You can feel yourself anchor as the other upper extremity is driving. So I go on this LXX stance, sagittal plane lunge. I go with my left hand up, so I have a type 1 motion occurring here because my pelvis is positioned in a right rotation with the shoulder girdle rotating left. So I'll drop it like maybe head high, and for me, I start to lose it. If I go any higher right here, yeah, I'm getting some motion, but I'm not getting that approximated like feel that I'm getting right now. So I can also turn into a C-spine mode, keep my head pointed forward, or just crank out the T-spine and let the nose and the eyes drive with the hand. I'll go to end range and add my progressive oscillations. If I wanted to triple this a little bit, hand in the same spot, if I wanted to, let's say for instance, add some flexion, then I'm going to change the height of my driver to maybe waist high or knee high. If I want to go a little more after the extension, I go beyond midline with my hand positioning, and I like to take the upper extremity, rotate and drive up on a little angle to force that extension, to help facilitate rather the extension. If I then wanted to go to a little in sync, and I guess to show you that perspective right here as well, so you have both perspectives in terms of what that looks like. So my tripling, my type 1, my right rotation left side bend with my knee high or waist high driver, which gives me the kind of the flexion throughout the T-spine. And if I wanted to go after a little kind of extension there, I'll take it a little further on over, past and beyond midline, and then add progressive oscillations. Now if I want to go type 1 in sync, right leg forward, left leg back to give us our left rotation for type 1. So just to kind of get things kind of kicked on off, starting in the sagittal plane with the lower extremity driver. And now what I can do is add my tripling effect of my flexion here with my knee high driver. And then to get a little more extension, go a little bit beyond midline. I was a little bit too high there, so I was kind of losing out on what I should have been mobilizing in the mid-back T-spine there. I'll go with a shoulder to neck high, or chin high driver to drive the extension. Same thing on this side. Boom, boom, boom. I'll add a little progressive oscillation, go after a little extension now. Go after a little extension. Those are type 1 in sync and out of sync. I'm gonna grab one of these little guys right here. I'll progress with these to adding, so I can drive in both positions. Obviously I'm set up for this type 1 out of sync right here. I can come off the wall then, and then add a progressive oscillation row off the wall, in which this chain reaction like effect with this multi-joint approximation of this proximal stability for distal mobility, proximal acceleration, to wind things up like this funnel called this tornado-like effect further in the chain that we've talked about here. If I add this type 1 here, type 1 out of sync, I will then come here, add this right rotation, so I'm going in sync now. I'm going after this right hip to get more internal rotation and some good right rotation of the thoracic spine. It depends ultimately, I guess, where the arm is and where this right arm is kind of driving. I could have a type 2 right rotation and right side bend here, based on where I'm pulling, where I could have this right rotation and this left side bend, so I'm getting this type 1 in sync, just kind of in the reverse here. And then I can set myself up and drive type 1 in sync to my type 1 out of sync right here. And I feel this huge collaborative kind of stretch throughout the trunk on these guys. What it'll look like from this position here, type 1 out of sync, and right here with this mushing, this force being provided, this closed kinetic chain like approximation right here, it's helped driving this left rotation and right side bend of the thoracic spine, the internal rotation right now at the left hip. If I want to drive a little more extension right here, can help preset me for a little more type 1 out of sync right here. You can then add squishy med ball to it, or a little dumbbell. So a great way to go after mobilizing the scapulothoracic joint, T-spine, and the hips. A great way to get your hands in there for some FMR. And a great way to further assess and then same thing here. I want to bias a little extension. I can. In sync driver, out of sync load. Episode 9, type 1, in sync, out of sync, closed kinetic chain like progressions. We're going after type 2 in sync and out of sync next.